Hi, this is Dr. Joe Esposito, and we're excited today to be on the set with Dr. Carl Oliger to discuss diabetes on AlignLife Interview. So, Dr. Carl, welcome to AlignLife Interview.
Thanks for having me.
I'm glad you're on the show today because of your previous experience with diabetes. I think it'd be nice for the viewers to kind of understand your history and why you've had such great results in management of the blood sugar imbalance. So, tell a little bit about your story.
Well, I guess it kind of started off where I was noticing for years I was keeping some extra weight, having lows with sugars, wanting to snack, and then overeating. And then it came to a point where just in a month's period, I kind of started forgetting a lot of things, and my weight dropped drastically. And then for just a few days there, I started having some having to get up in the evenings to use the restroom, which was strange for me. I ended up going to my primary care physician, who dismissed it as something else. That's important to realize that people can have their symptoms dismissed. However, I was adamant I would not leave the office till he checked my blood sugar. And by the time they got me to the ICU that afternoon, my blood sugar was well over 600.
Well over 600. So that's one of the important things about this month's Condition of the Month, that we'll actually be offering to check blood sugar in the office for people that may have some of the symptoms that you brought up. Weight gain or fast weight loss, some of the mental confusion, frequent urination, and any other typical symptoms, or are those the primary ones?
Well, fatigue is one of them. You just feel like you're in a cloud, and you can be tired all day. Frequent naps, things like that, just seem like and those are things that also have to do with adrenal dysfunction, some other things too. But all those things in combination could be a sign that you need to get checked out by somebody.
Excellent. So, the conventional medical management of a condition, whether we call it dysglycemia or diabetes, is normally going right to a medication, correct?
Definitely.
What's your philosophy, and how do you think if someone had imbalance of blood sugar, how would your approach or AlignLife's approach be different than the conventional medical mindset?
Well, what I always tell people, medicine has its place. Okay, if your house is on fire, you call the fire department. Once your fire is out, then you go and reconstruct your house. And that's what I did. I was on insulin 4 times a day for about 4 months. And then I thought, well, you know something? I'm telling my patients these things. How about if I kind of do some of the things that I'm doing? So, for example, one of the things was actually getting out and exercising. That's huge. A lot of people don't realize that you get out and just walk, 20, 30 minutes a day. Dropping some of the pro-inflammatory foods, such as anything made with white flour, grains, tricking yourself into thinking that you're getting sweet things like by drinking diet drinks and soda. Your body's going to want more sugar after that. And a bunch of different products like that. What also that I've done is started to take high levels of omega-3 fatty acids, or omega-3 plus. That is essential. I take 4,000 to 6,000 milligrams a day. I'm also taking the sugar balance, B12 to help with possible neuropathies, because that's great for nerve.
That's a good point, Doc, because if we look at the history of the 310 million Americans in the United States, we have about 52 million that are suffering with pre-diabetes. That's a significant part of the population. And of the people that are dealing with diabetes, about 30% have some form of neuropathy, tingling in the hands, problem with carpal tunnel, problem with paresthesia, abnormal sensations in their body. And sometimes in chiropractic, we may look down the road of a subluxation, and it could potentially be an actual blood sugar imbalance. So the beauty of the AlignLife approach is that we're always looking at nerve function, but we're integrating the approach. And this month we'll be checking blood sugar. So the nutrients you talked about, Sugar Balance, which is an herbal remedy with minerals to help balance blood sugar. We talked about omega-3 plus, which is a fish oil complex to make your body more sensitive to insulin. And the other product, Balance Protein, which has 5 different types of fiber. It has protein, it has guar gum, it has the oat bran. It has so many different forms of the bran of the fiber that can really help balance that blood sugar. So if we're dealing with someone who's really having issues, taking a couple of doses of balanced protein a day in addition to sugar balance and omega-3 usually can take the patient out of that crisis. So you were on insulin, and
Yes.
now you're off.
Definitely. 250 pounds, now I'm 190. It didn't just happen at once. I had to really become proactive in my health. And again, I never suggest to anybody, don't go on your medication. But if it is your goal to not be on medication for the rest of your life and to take care of yourself, my big thing was, diabetics, they lose their sight. They may lose a limb or something like that. I have 3 wonderful children that it would kill me to not be able to see them. Couldn't see my wife, couldn't play with my kids out in the yard because I lost a limb because I'm too stubborn not to take care of myself. So that's why I decided to take care of myself. And again, I'm not saying that I'll never have to use insulin, but right now I don't need to use it.
So you're saying the impact is not only the fatigue or the or maybe some tingling in the hand, it could be life-threatening in the long run. So taking these measures more seriously is something that the patients should embrace now. Is that what your thoughts would be?
Oh, definitely. Take it seriously now. Hit it in the beginning so you have a longer, healthier lifestyle, so you can see your family. For me, it's always about family. Am I going to see my family longer? Am I going to be able to work with patients and touch their lives and have them not have to go down this road? Because you're told that you will have to be on this medicine for the rest of your life. You're told that you will eat this way. If you change your diet and change some of the things that you're doing, you won't have to take as much or maybe not at all.
Excellent. Well, thanks for coming on the AlignLife interview today. If you want to get the blood sugar checked or have a consultation, a free consultation at AlignLife, go ahead and schedule that appointment today. We want to thank Dr. Carl Oliger for his contributions on AlignLife interview discussing the concerns of diabetes and natural solutions for managing diabetes. If you have the condition or you're interested in finding out more on managing diabetes, go to alignlife.com/diabetes for more information, articles, and natural solutions to the condition.